In the average phrase that he speaks, how many words now?
5 to 6 maybe.
That's terrific. He was at best saying one word at a time.
Right. He hardly had like 10 words in total, I would say.
In children, a stroke can occur at any time of the day or night. Because we have a multidisciplinary program for children with stroke and cerebrovascular disorders, we can offer a dimension of care for children and their families that really isn't available in most other hospital centers.
She's really off balance compared to before these episodes that we saw.
You notice it all the time, or is it intermittent that she's less steady? When a child has a stroke, it's a very stressful time for a family, as well as for the child, to try and understand why this happened, as well as what can we do to prevent it in the future. And then long term, there's also significant anxiety, depression, and even post-traumatic stress disorder. And it's our job to try and reassure the families and make sure that they understand that there was nothing they could have done, that they did everything they possibly could, and that we want to help move them forward and help the child as best we can.
Oftentimes, children who have strokes begin their course of care in our intensive care units. That child may be experiencing consequences from the stroke that need to be addressed.
When a stroke occurs in a child's life really matters developmentally. What is affected by the stroke matters a great deal as well. Not only are we seeing kids at different stages of their development, every child is unique. Every brain is unique. Every injury to a brain is unique.
We're not just concentrating on getting the clot out or doing the physical therapy, but we're also looking at educational treatment and educational support and neuropsychology and cognition so that we can integrate all of this into the one child. On the morning that he came to medical attention, he was found outside of his bed.
We did some fast imaging on him at the time. I think that was prior to him being discharged.
One of the main goals is that we work as a team, and I think that can be extremely helpful to families when they know they can get care all in one place. We have weekly meetings where we are discussing different patients, where we can look at their neuroimaging findings, and being able to work in the team and having more of that interaction is very important.
What I love about working in an interdisciplinary model, I walk out of my room and I literally bump into a neurologist, physical therapist, occupational therapist. I think she's lacking about 15 degrees from neutral, even passively.
Passively, yeah.
Does that hurt?
No.
You're doing great.
You do such a good job with wearing your nighttime splint. We just made a new one a couple weeks ago.
We have a long-standing relationship with our families, and that's actually something that's really rewarding for our work, and that's what keeps us going and finding better ways of helping them.
It's important to know why a stroke happened because there may be treatments to prevent recurrences of the stroke in the future. Boston Children's Hospital is not only filled with people who offer technically the best care available, but it's filled with great people who have great minds and have great hearts and are driven really by only one thing, that is to offer the best care to children who are ill as possible. It's exciting to be a part of that kind of a mission.